More than 3 billion people in almost 70 countries and territories now living under some form of lockdown due to coronavirus. But we know that testing is not readily available in many places, so that number is likely to be much higher.
I must give the British people a very simple instruction. You must stay at home.
This is what we all need to be doing, and we're going to make sure this happens.
पूरे देश में आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
The trajectory is very clear. Act now or risk the virus taking hold as it has elsewhere.
Malaysia's lockdown has been extended for another 2 weeks until the 14th of April.
More European countries are following Italy's footsteps, putting in these unprecedented measures in post-war Europe.
Stiamo affrontando un'emergenza nazionale.
Many, and so also I, did not have the idea of this thing really was going to happen like this. I mean, when they began talking on locking everything down, you just said that's ridiculous. I mean, what was happening in China, you see that as, okay, that's very far away, and also maybe it's happening there, but I mean, you see that as a very different place from your home. So you would not imagine that thing getting to be serious.
Top officials say they were shocked to see pictures of citizens flocking to parks and marketplaces despite new lockdown measures that were announced the night before.
Until about 3 weeks ago, there was a sense of denial. People were impressed by how the Chinese authorities handled the situation, but it was seen as sort of a distant issue more than it was a local one.
The death toll in Italy soaring.
About a quarter of the Italian population will be affected.
Then Italy got hit. Even then, it was people started to feel it as being closer to home, and actually started empathizing on a more individual level, and not just as sort of as a society, this is a bad thing to go through, but it was still seen as something that's not going to happen here.
The Institute of Epidemiology, Disease Control and Research Center is the only place in the entire country of 160 million people that has facilities to test COVID-19 virus.
In the news, it says that only a few amount of people are being affected by the COVID-19 virus in Bangladesh. But it is completely untrue. The reason it's not being reported or the statistics are not showing the numbers are because there are not proper kits, there are not proper healthcare, there are not proper doctors or nurses who can treat and detect the symptoms of coronavirus. One of the most important things that we have to point out about Bangladesh that it's a very densely populated area, so it's harder for people to maintain and to practice social distancing, especially people living in the slums.
I got back to Malaysia on the 16th, and before the 16th of March, where I live in the place called Leamington Spa, a lot of the population who actually lives in Leamington are still going about their daily lives. So a lot of them are still going to shops, taking public transport, and no one is really self-isolating at home.
Maybe to apply it on a blanket scale, a lot of people chose to turn a blind eye at first to say that, yeah, it's not going to come to me. And they just sort of push it till the last minute to say, okay, it's here. What do we do?
I work in marketing for two main Italian car companies. Things were going pretty well. We did the last presentation of the new car on second to last week of February, and everybody was in a room and we were having this, let's say, big party. And that was more or less the last thing we did, like with many people together. Many people just fled from Milan, just ran on trains and took the cars to the south of Italy. So that like many who were maybe ill or did not know to be ill went there, saw the families, saw the parents and the grandparents and so on, and so the thing spread on. So that's how the virus got really there.
I would say that in March was the first time it really became a subject of conversation with my friends. The government or officials of the university would just send us an email and told us to wash our hands for 20 seconds and self-isolate if there were any symptoms and call NHS if we needed any advice. The UK took a really long time to get to this point of lockdown.
As you can see, it is absolutely deserted. These are the streets of London at the moment.
At the time of the emergency, I was in Sofia, the capital of Bulgaria. I had actually just got off the plane from Geneva to Bulgaria, and I found out that everything was going to be shut on Saturday. But because it was Friday night and the law had technically not gone into place, there were a lot of people on the main streets. A lot of people were out drinking, And then the next day, it was as if no one had ever existed. My friend is Bulgarian, and he said to me he had never seen the capital so quiet and so dead in his entire life.
Southern parts of the Netherlands are actually in quarantine because it's of how high the cases are. I would say that even though the Netherlands reacted later to it, and also right now there is a shutdown in the Netherlands, and I would say a wide majority of people are actually following that through.
As of now in Toronto, there is a strong lockdown in place. The borders have been locked between Canada and the US, post-essential travel. And I think that was a very important measure that our Prime Minister was ready to enact. I'm quite sure that all of us, or at least most of us, will adjust to minimal social contact and not embrace physical distancing, but understand that it will become the new norm for the next little while.
We begin with the latest in Malaysia as Prime Minister Mahathir Mohamad handed in his resignation to the King earlier today.
Now, this decision shocked Malaysia, and it comes in the midst of plans by...
A changing of the guard in Malaysia that critics are calling the death of democracy. Muhyiddin Yassin swearing in as Prime Minister, capping a tumultuous week in the country's politics.
The government was going through crazy tumultuous situations that is so far removed from the reality that the citizens are living. So the government change happened, and people were confused. People were scared. They forgot almost there's a pandemic that's upcoming.
Wabak ini memerlukan tindakan drastik. Kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan mulai 18 Mac 2020 di seluruh negara.
In Malaysia, the government did take a lot of steps to try and curb the coronavirus, but a lot of those steps could have been done with much more thought. For example, with crossing the state in Malaysia, if you lived in a different state and you needed to go through the other state, you needed to fill a police report, but a lot of police stations got overwhelmed. It's also disappointing that a lot of the public doesn't really seem to take this seriously as they should, and that's why the army got deployed. So if Malaysians don't act serious and stay at home, it could lead to another situation like in Italy.
Boris has announced at one point the possibility of a herd immunity would be what Britain would be looking towards, where he expects 60 or 70% of the population to get infected by the virus, which I think is completely ridiculous, and no other countries have been looking at this measure.
In terms of building up a herd immunity within the UK, what sort of percentage of people need to have contracted the virus?
Probably about 60% or so.
60%? I mean, even with that, even looking at the sort of the best case scenario, and you were saying, half of 1% to 1% fatality in something like this, that's an awful lot of people dying in this country.
The way the government acts towards the virus, or the way the government is implementing rules and decisions regarding the virus, definitely impacts and kind of like shadows the way in which people are taking it seriously.
Haunting images, flames, plumes of smoke, and firefighters desperately battling walls of fire.
The flames consumed hundreds of properties, leaving local communities shocked.
A lot of people in Australia suffered during the bushfire crisis. People were already experiencing a lot of financial uncertainty. People had lost their houses, people had lost their businesses, and this was happening all over the country. During that time, Australians were already angry about how the government dealt with that crisis. We then only had a couple of weeks before we were hit with this second crisis, the coronavirus pandemic, when the government told people, stay calm, business as usual. People didn't trust that. There was already that disenfranchisement, and they felt like they had to go out and panic buy, start hoarding food. A lot of different behaviours that we kind of haven't seen or experienced before.
I think there's a lot of lessons to be learned in terms of preparedness for future pandemics and also short-term recovery to face this kind of disruptions. We can see that by staying at home or by shutting down production, the global economy literally is going down, and we are in recession with the possibility of going into depression.
There hasn't been a clear message though, and I think this is the problem. And there's a lot of frustration from people about the messaging that we're receiving from government. Now, a lot of people didn't actually understand what parameters that set for them in their day-to-day lives. Could they go to work? How far apart could they stand from someone? There was no real clear guidelines about how people should be going about it. It was very much media lines, I guess.
He shouted, I don't want your coronavirus in my country. And he swung a punch at me, and that was when my nose started bleeding really badly, and basically the whole street was filled with my blood. I
have a friend who was walking somewhere near the university, and some kids were shouting at him, coronavirus at him, which is completely racist. And so why should we be bullied for something that we haven't done, you know? It's completely ridiculous.
Tell them to move! Why do you keep calling this the Chinese virus? Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China.
What scares me is the violence and chaos the virus has brought with it. I think racism has spiked and the economy isn't doing as well.
I think it's very important that at a time like this, people stick together. So instead of being very racist even towards our own people in Malaysia, I'd say, because of the whole tabligh issue and how a lot of Muslims and Malays attended the religious events, a lot of people should not be racist towards those groups. You know, always give people benefit of the doubt. We're in a time where we need to be there for each other instead of being negative and pessimistic towards one another. So I think at a time like this, it is very important to have strong mental health and really strong optimistic attitude in order to get through this.
Even just this past week of adjusting to all of this so quickly, there were certain moments at the end of the day where I did feel alone. I suppose that would become a stronger feeling as the weeks go by, but knowing that we're all kind of on equal playing ground at this moment is somewhat comforting, but also at the end of the day, just so bizarre.
Recently, it's been quite heartwarming to see a lot of the innovations that people are coming up with to find ways to still maintain that connectivity through the internet.
At this time, I've been more connected with people than I've ever been, probably since the beginning of the year. If I felt lonely or scared about the pandemic, honestly, I do talk to a friend about it, because at this time, I do have more common with my friends than I usually do. They're also probably scared, and we do confide in each other.
Frontliners risking their lives every day. This is true, not all heroes wear capes, and they're genuinely the true heroes of the world that the rest of us have to be eternally grateful for.
It really shows how great you are as a person in these times of need to be really giving up everything and also giving in to help those who are in need.
Everybody who's been volunteering and helping elderly getting their shopping done and giving them company, whether from a distance or online, thank you very much. You're doing so much for everybody's social health.
For grocery delivery, pharmaceutical deliveries, whatever it is that they need from outside if they don't want to go out.
Musicians have set up washing stations to protect the homeless.
Melbourne's Sikh community rallying to prepare meals for delivery to anyone most in need.
We are all in this together. We should do what we can to help the situation.
The best way for us to help them is to do our jobs and stay at home, basically, and do our part in flattening the curve so that they can return home safely to their loved ones as well. Their loved ones at home probably are so worried. Do this apart from social distancing and everything can go back to normal.